You know, a lot of parents are always happy when those kids finally go to sleep. But what if they find their little ones snoring lately? Is this something that they need to be worried about?
Dr. Richard Kang, he is Director of Pediatrics at Dignity Health Northridge Hospital, joining us now to discuss this. Dr. Kang, thanks so much for being with us this morning. And a new study finds that there is a link between snoring and brain changes in children. So first of all, is this research talking about occasional snoring or frequent snoring?
Hi, good morning. Thank you for having me. So yeah, the study comes out of the journal Nature Communication, and it correlates the frequency of snoring to the likelihood of behavioral changes and brain changes. And it says the more frequent the snoring is, such as habitual snoring, which is 3 or more nights a week, it was strongly associated with these changes.
Is this something that, you have to be concerned about if the brain is just naturally changing as a kid? Sometimes our kids snore, sometimes they don't. What issues could be linked to this, or is this just normal?
So the reason this study was groundbreaking is it's not the first study to show behavioral changes with snoring, but it actually showed the structure of the brain changing. What they did was they studied over 10,000 children 9 to 10 years old, and they did MRIs of their brains, and what they saw was that there was thinning of the gray matter. So if you think of the brain as a computer, the gray matter are the computing units, and the white matter are like the cables that transmit the data between the computing units. And they saw that there was thinning of the gray matter in the areas that control reasoning and impulse control. And these were associated with behavioral changes in the children that they saw through surveys that they had with the parents.
Well, Dr. Kang, if a parent notices that their child is snoring frequently, what should they do? And what are other symptoms and issues that should they be looking out for?
So yeah, we didn't want to alarm all. Snoring could be a sign that there's some obstructions breathing, but occasional snoring is probably okay. But what we're trying to say is we shouldn't ignore any type of snoring, and we kind of see what the frequency is. If we're approaching 2 or 3 nights per week that your child is snoring, it's probably a conversation that you should start with your pediatrician to see, 1, what the causes might be, and 2, what the next steps such as treatment can be as well.
And obviously bedtime struggle for a lot of parents these days. If this is an issue, any advice you have on, as you're trying to work this out, making that process easier and keeping those little ones down?
Yeah, good sleep hygiene is always a good thing, especially in the younger children. We want uninterrupted sleep, so we want to make the room as comfortable as possible, having a good sleep schedule, turning off those iPads, iPhones at a time. We know those can keep your children up late at night. So I think good sleep hygiene, make the room as quiet and comfortable as possible. And then hopefully if they get good uninterrupted sleep, it's good for their brain development, as well as, the less likely that they'll have these behavioral changes that we're seeing with children who do snore.
All righty. Dr. Kang, thank you so much for joining us this morning. We appreciate it.
Thank you. Thank you for having me.
Take
Have
care.
a good day.